If you or a loved one is over 60, I urge you to pay close attention to what I'm about to share. This message is not just another health tip or a routine reminder, it's a potentially life-saving alert that could make all the difference for you, your family, or someone you care about deeply. As we age, our bodies change in ways that can make us more vulnerable to certain health risks, and unfortunately, some of the very medications that are supposed to help us can sometimes do more harm than good, especially when it comes to our hearts. What you're about to hear could honestly save a life. Every year, thousands of older adults experience unexpected heart problems, and in many cases, these issues are linked to medications that are commonly prescribed and widely considered safe. But the truth is, as our bodies age, the way we process these medications changes. Our kidneys and liver may not work as efficiently as they once did, and our heart muscle itself can become more sensitive to certain drugs. This means that a pill that was once harmless, or even helpful, can suddenly become dangerous, leading to complications like irregular heartbeats, high blood pressure, or even heart failure. I'm Dr. Carter, a board-certified cardiologist with over 20 years of experience caring for older adults. I've seen firsthand how easy it is for well-meaning people to fall into the trap of thinking that if a medication is prescribed by a doctor, it must be completely safe. But the reality is, even the most common pills can have unexpected side effects, especially in people over 60. Today, I'm issuing a critical warning about a specific class of medications that are silently damaging the hearts of older adults across the country. These are not rare or experimental drugs, they're medications that millions of people take every day, often without a second thought. Let me be clear, I'm not here to scare you, but to empower you with information that could protect your heart and your health. Many older adults are prescribed medications for conditions like high blood pressure, diabetes, arthritis, or chronic pain. While these medications can be essential, some of them, especially certain types of anti-inflammatory drugs, blood pressure pills, and even some over-the-counter remedies, can put extra strain on the heart. For example, non-steroidal anti-inflammatory drugs, or NSAIDs, such as ibuprofen and naproxen, are widely used for pain relief, but they can increase blood pressure and cause fluid retention, both of which are dangerous for people with heart problems. Another common culprit is certain types of blood pressure medications, like calcium channel blockers and beta blockers. While these drugs are often necessary, they can sometimes cause the heart to beat too slowly or lead to dangerous drops in blood pressure, especially if the dose is too high or if they interact with other medications. Diuretics, often called water pills, are also frequently prescribed to older adults to help control blood pressure or reduce swelling, but they can cause imbalances in potassium and other electrolytes, which can trigger irregular heart rhythms. Even some medications for diabetes, depression, or sleep can have hidden effects on the heart that aren't always obvious until a problem arises. The problem is, these risks often go unnoticed until it's too late. Many older adults attribute symptoms like fatigue, dizziness, swelling, or shortness of breath to just getting older, when in fact, these could be warning signs that a medication is affecting the heart. That's why it's so important to be proactive. If you or someone you love is over 60 and taking any prescription or over-the-counter medication, I urge you to take a few simple steps today. First, make a complete list of every medication you're taking, including vitamins and supplements. Bring this list to your next doctor's appointment and ask specifically about how each medication might affect your heart. Don't be afraid to ask questions or request a medication review. Your health and safety are worth it. Second, pay close attention to any new or unusual symptoms, no matter how minor they may seem. If you notice changes in your energy level, swelling in your legs or feet, chest discomfort, or irregular heartbeats, contact your healthcare provider right away. These could be early signs of a medication-related heart problem, and catching them early can make all the difference. Third, never stop or change a medication without talking to your doctor first. Suddenly, stopping some medications can be dangerous, and your doctor can help you find safer alternatives or adjust your dose if needed. Finally, remember that you are your own best advocate. The healthcare system can be complex, and it's easy for medication risks to slip through the cracks, especially when multiple doctors are involved. By staying informed, asking questions, and working closely with your healthcare team, you can help protect your heart and your quality of life. I've seen too many patients suffer needlessly because they didn't know about the hidden dangers of common medications. Don't let that happen to you or someone you love. So, if you or a loved one is over 60, take this warning seriously. Review your medications, talk to your doctor, and stay alert for any changes in your health. Your heart is too important to take chances with, and a few simple steps today could save a life tomorrow. Thank you for listening, and please share this message with anyone who might benefit. Together we can help keep our hearts and our loved ones safe and strong for years to come. This isn't fringe science, it's actually a major concern in geriatric cardiology. The pill in question is NSAIDs, common over-the-counter pain relievers like ibuprofen, which you might know as Advil or Motrin, and naproxen, also known as Aleve. Here's what the data shows they can do to an older heart. So, here's the thing. They cause fluid retention and can really spike blood pressure. This means your heart has to work much harder, which can destabilize previously controlled hypertension and, unfortunately, push patients into heart failure. They also increase the risk of blood clots. NSAIDs can make platelets, stickier, which raises the risk of heart attacks and ischemic strokes, especially in people who already have artery disease. And, well, they can cause direct injury to the heart muscle. Emerging research actually points to a toxic effect on myocardial cells, which may potentially accelerate heart muscle weakness. When it comes to managing your health, especially as we age, the medications we take can be both life-saving and, at times, risky if not managed carefully. One of the most important things to understand is that some drugs, even those that are commonly prescribed or available over the counter, can interact with each other in ways that are not always obvious. These interactions can sometimes be dangerous, especially when it comes to medications used for heart health. For many seniors, heart medications are a daily necessity, helping to control blood pressure, prevent blood clots, and manage heart failure. However, what many people don't realize is that certain pain relievers, specifically a class of drugs known as NSAIDs, non-steroidal anti-inflammatory drugs, can have a dangerous interaction with these heart medications. NSAIDs include familiar names like ibuprofen, naproxen, and even some prescription painkillers. While they are effective at reducing pain and inflammation, they can also interfere with the way your heart medications work, sometimes with serious consequences. Let's take a closer look at how these interactions happen and why they can be so dangerous. When you take a heart medication, such as a diuretic, an ACE inhibitor, or a blood thinner, your doctor has carefully considered how these drugs will help your body function better. Diuretics, often called water pills, help your body get rid of excess fluid and salt, which can lower blood pressure and reduce the workload on your heart. ACE inhibitors relax blood vessels, making it easier for your heart to pump blood. Blood thinners, as the name suggests, help prevent dangerous blood clots that could lead to a heart attack or stroke. Each of these medications plays a specific role in keeping your heart healthy and your blood flowing smoothly. But when you add an NSAID into the mix, things can get complicated. NSAIDs work by blocking certain enzymes in your body that cause pain and inflammation. Unfortunately, these same enzymes also help protect your kidneys and regulate blood flow. When you take an NSAID, it can reduce blood flow to your kidneys, making it harder for them to do their job. If you're already taking a diuretic or an ACE inhibitor, your kidneys are already working harder than usual. Adding an NSAID can push them over the edge, leading to kidney damage or even kidney failure in severe cases. This is especially true for older adults, whose kidneys may not be as resilient as they once were. The risks don't stop there. NSAIDs can also cause your body to retain salt and water, which can raise your blood pressure and undo the benefits of your blood pressure medications. If you're taking a blood thinner, NSAIDs can increase your risk of bleeding, sometimes in ways that are hard to detect until it's too late. For example, you might develop a stomach ulcer that starts to bleed, or you could experience internal bleeding that doesn't show any obvious symptoms at first. These complications can be life-threatening, especially for seniors who may already have other health issues. It's important to remember that not all drug interactions are immediately obvious. Sometimes, the effects build up slowly over time. You might start to feel more tired than usual, notice swelling in your legs or ankles, or have trouble breathing. These could be signs that your medications are not working as they should, or that your kidneys are struggling to keep up. That's why it's so important to talk to your doctor or pharmacist before starting any new medication, even something as seemingly harmless as an over-the-counter pain reliever. If you're currently taking a diuretic, which is often prescribed to help your body eliminate excess fluid and lower your blood pressure, you need to be especially cautious. Diuretics are a cornerstone of treatment for many heart conditions, including high blood pressure, heart failure, and certain types of kidney disease. They work by helping your kidneys remove sodium and water from your body, which reduces the amount of fluid your heart has to pump. This can make a big difference in how you feel and how well your heart functions. However, because diuretics put extra stress on your kidneys, adding an NSAID can make it much harder for your kidneys to keep up. The combination can lead to a dangerous buildup of fluid, increased blood pressure, and even acute kidney injury. This is why doctors often warn patients not to take NSAIDs if they are already on a diuretic, unless it is absolutely necessary and closely monitored. The same caution applies if you are taking a blood pressure medication like an ACE inhibitor or a blood thinner. ACE inhibitors are widely used to treat high blood pressure and heart failure, and they work by relaxing blood vessels and making it easier for your heart to pump blood. Blood thinners, such as warfarin or newer medications like apixaban and rivaroxaban, are prescribed to prevent blood clots that could cause a heart attack or stroke. Both of these types of medications are essential for many people, but they also come with their own set of risks. When you add an NSAID to the mix, you increase the chances of something going wrong. For example, NSAIDs can make it harder for your blood pressure medication to do its job, leading to uncontrolled high blood pressure. If you're on a blood thinner, NSAIDs can increase your risk of bleeding, both internally and externally. This is because NSAIDs themselves can thin the blood and irritate the lining of your stomach, making it more likely that you'll develop a bleeding ulcer or other serious complication. The consequences of these drug interactions can be severe. Adding an NSAID to your regimen when you're already taking a diuretic, an ACE inhibitor, or a blood thinner can lead to kidney failure, loss of blood pressure control, or even dangerous bleeding. In some cases, these complications can develop quickly and require emergency medical attention. In others, the damage may build up slowly over time, making it harder to recognize until it becomes a serious problem. That's why it's so important to keep all of your healthcare providers informed about every medication you take, including over-the-counter drugs and supplements. If you ever have questions or concerns about your medications, don't hesitate to ask your doctor or pharmacist. They can help you understand the risks and benefits and work with you to find safer alternatives if needed. Remember, your health and safety are always the top priority, and being informed about potential drug interactions is one of the best ways to protect yourself. The risk is not dose-dependent. Even, low-dose occasional use in a vulnerable older adult can be the trigger for a major cardiac event. The heartbreaking truth is that every single day, millions of people, many of them are parents, grandparents, neighbors, and friends, reach for a familiar bottle of painkillers, hoping for just a little relief from the aches and pains that come with age. Whether it's the persistent throb of arthritis in the knees, the dull ache of a sore back after a restless night, or the sharp twinge that flares up after a simple walk to the mailbox, these discomforts are a daily reality for so many older adults. For them, the promise of quick over-the-counter relief is tempting and often feels like the only option. The ritual is almost universal. A pill bottle rattling in the early morning, a glass of water on the nightstand, a sigh of hope that today will be a little easier than yesterday. But behind this simple act lies a story that is rarely told, a story of risk, of unintended consequences, and of a silent danger that too often goes unnoticed. What most people don't realize is that, in their search for comfort, they may be making a trade-off that could have devastating consequences. The pills that promise to soothe aching joints or calm a sore back can, in fact, come with a hidden cost, a cost that is measured not in dollars, but in heartbeats. Many of the most common painkillers, especially non-steroidal anti-inflammatory drugs, or NSAIDs like ibuprofen and naproxen, are linked to a significantly increased risk of heart attack, stroke, and other serious cardiovascular events. This risk is especially pronounced in older adults, who are already more vulnerable due to age-related changes in the heart and blood vessels. Yet, despite mounting evidence and repeated warnings from health experts, millions remain unaware that the relief they seek may be putting their lives in jeopardy. It's a cruel irony. In the pursuit of a pain-free day, they may be gambling with their future. Family members watch with concern as their loved ones reach for another pill, not realizing that the very medication meant to help could be causing harm. The look of worry on a spouse's face, the quiet anxiety of an adult child, the isolation felt by seniors who struggle to manage their pain alone, these are the unseen costs of a problem that is all too common. But there is hope, and there are safer alternatives. One of the most widely recommended options for managing mild to moderate pain especially in older adults, is acetaminophen, known to many by the brand name Tylenol. Unlike NSAIDs, acetaminophen does not increase the risk of heart attack or stroke, making it a safer choice for those with existing heart conditions or risk factors. However, even acetaminophen is not without its own risks, particularly if taken in high doses or for extended periods, as it can affect the liver. That's why it's so important to use any medication, no matter how familiar or seemingly harmless, under the guidance of a healthcare professional. Doctors can help determine the right dosage, monitor for side effects, and ensure that pain management strategies are tailored to each individual's unique needs and medical history. In some cases, a combination of medications and non-drug therapies may offer the best results, minimizing risk while maximizing relief. The key is to have an open, honest conversation with your doctor about your pain, your concerns, and your goals for treatment. Don't be afraid to ask questions, seek second opinions, or explore new options. Your health and well-being are worth it. Beyond medication, there are a variety of non-drug approaches that can make a real difference in managing chronic pain. Physical therapy, for example, is a powerful tool that can help restore mobility, strengthen muscles, and reduce discomfort without the risks associated with many painkillers. A skilled physical therapist can design a personalized program of exercises and stretches that target the specific areas of pain, helping to improve function and quality of life. For some, simple lifestyle changes, like regular gentle exercise, weight management, and a healthy diet, can also have a profound impact on pain levels and overall health. Techniques such as mindfulness meditation, yoga, and Tai Chi have been shown to help some people cope with chronic pain, reducing stress, and improving mood. Support from family, friends, and community resources can provide encouragement and practical help, making it easier to stick with new routines and stay motivated. Most importantly, these approaches should always be explored in partnership with a healthcare provider who can help ensure that they are safe and appropriate for each individual's situation. Pain is a complex, deeply personal experience, and there is no one-size-fits-all solution. But with the right support, information, and guidance, it is possible to find relief without sacrificing long-term health. The journey may not be easy, and there may be setbacks along the way, but every step taken towards safer, more effective pain management is a step toward a better, healthier future. If you or someone you love is struggling with chronic pain, know that you are not alone, and that there are options, resources, and people who care, ready to help you find a path forward. This is a public health alert. Please share this warning with every older adult and caregiver you know. Post it in your community groups and family chats. This knowledge is protective. Your heart's safety depends on being informed. For clear, trustworthy medical advice you can actually use, subscribe to our channel and hit that notification bell. Let's build a community focused on true health.